please. Thank you for inviting to talk about the COVID-19 disease and vaccination in children and adolescents. So I'm Mike. So this is a figure taken from the Center for Health Protection, Hong Kong Special Administrative Region, up to the 16th of March. And you can see this is the admission figure of children in Hong Kong. And very unfortunately, in the fifth wave Omicron outbreak, we have 6 deaths up to this moment, age 17 and less. So 6 children already died during this Omicron outbreak. So this is a very sad news to the population in Hong Kong. And regarding the vaccination rate, you can see this is written here. The vaccination rate amongst the elderly and children is relatively low because you can see from age 3 to 11, our vaccination rate only 55%. And regarding the elderly, age 80 years and above, only around 55%. And regarding adolescent, actually not bad. And as Dr. Goh mentions, we started the vaccination program since July last year. Now 95% of the adolescents 12 to 19 already being vaccinated. Regarding the Omicron, it had a very short incubation period, around 3 days, range from 2 to 7, with a very high transmissibility, the R0 up to 10. Symptoms mainly we observe mainly sore throat and with a high fever, running nose. We observed that anosmia and ageusia relatively less compared with other variants of concern. And there are special symptoms related to the Omicron. I will mention in the following slides. And we already observed the Omicron outbreak involve more children. Actually, since they happen in Africa, they involve more children less than age of 5. And also in Singapore, when they adopt a strategy of living with the COVID-19, 所謂嘅病毒共存, they already observed many children affected by the Omicron already. And in early November, they reported many children admitted to the intensive care unit with a so-called the MISC, the multi-system inflammatory syndrome, 兒童多系統發炎綜合症. This is a figure we analyzed in Hong Kong. Up to the end of February, the 28th of February, 2,000 children involved in Hong Kong, less than age 17. 3.84% admitted to the PICU, 30 of them among the 2,000. And you can see none of them received the vaccination. Even the 5 to 11 years old, the 12 to 17 years old, only small number received the vaccination and they being admitted to the PICU. And although we observed that most of the children admitted to the hospital, their symptoms relatively mild and they recover within 7 to 10 days. We advise the parents in Hong Kong to observe the guidance written by these 4 societies, and we have the QR code here for the parents to scan the QR code to obtain the information how to take care of their children at home. But unfortunately, we observed that severe cases of COVID in children, they had the following features. They have convulsions more than 30 minutes with altered conscious level or with severe respiratory distress. And we advise the parents that if their children got the following warning signs like the breathing fast, noisy breathing, blue lips, chest pain, fast heartbeats, decreased conscious level, confusion, convulsions, and persisting high fever and vomiting or poor follow intake, they need to bring their child to the hospital immediately. And we reported this MISC, the 多系統發炎綜合症, already in the Hong Kong Medical Journal in 14th of February. And we managed this boy, and he readmitted 4 weeks after recover from COVID, presented with a lymphadenopathy, persistent high fever up to 40 degrees Celsius with bilateral red eyes, and branchable erythematous rashes, a red and cracked lips, and strawberry tongue, and subsequently we diagnosed him as a MISC. We treated him in the pediatric intensive care unit, and fortunately he recovered uneventfully. And also we reported these symptoms in the first 4 waves, anosmia and aglosia in around 5% of my patients. Also, some of my patients got these symptoms, what we call the COVID toes, some tender lesions at the extremities, and bluish tender on palpations, and also some pictures of other patients. These are the COVID toes, 新冠腳趾. And in Omicron, we observe some special symptoms, like what we call the groups, the Xihao-症. You can see the narrowing of the airway of this infant, just like this small child. You can see the hoarseness of his voice because of the inflammation at the larynx, at the vocal cord. And this is important because this may cause the obstruction of his airway, and this needs intensive care and also immediate treatment. And also we see cases of COVID pneumonia. This is the X-ray film on admissions and on follow-up on recovery. And most importantly, we observe a few children. We attribute this might be the cause of death of these children, which is the acute necrotizing encephalitis, which is 急性壞死性腦炎. And those are the very devastating neurological conditions arise from a variety of the viral infection, including influenza, and also now we attribute this to the Omicron SARS-CoV-2 infection. And those patients presented with rapid changes in consciousness and focal neurological defect, vomiting, and also prolonged seizures. And we have 2 vaccines available in Hong Kong, the Sinovac vaccine, and from 15th of February onward, the age 3 and above can receive the Sinovac vaccine, and BioNTech vaccine available from age 5 and above since 16th of February. Regarding Sinovac vaccine, I'm very glad to hear from Professor Goh mention that it is very safe and very effective from age 3 to 17, very immunogenic, very safe and well tolerated, as we observe in our Hong Kong children. And the 3 microgram group, actually it triggered a very good immunologic response. And also this is very safe, with a well tolerated, and the adverse reaction reported actually really very few. And with a very good protection against symptomatic disease and also hospitalization in various countries, including Turkey, Chile, Indonesia, Brazil. And the mass vaccination campaign in mainland China showing that there's no major safety issue in the Sinovac vaccine. The other vaccine available, it is the mRNA, the BioNTech vaccine. We used this since July last year in Adolescent. It showed a very good safety profile and very great immune response in young adult. The immune response is even greater than for the adult counterpart. And how about the age 5 to 11 age group? This study showing that among 2,200 children, 2/3 of them given the vaccine and 1/3 given the placebo, and the effectiveness was 90.7%, which is safe and no severe complications. And in this study, no case of myocarditis was identified. And in another study published just recently, and showing that this is a vision network study in US among 10 states, and showing there's a waning of the immune response and after the vaccinations and among the children. But however, with the booster dose, there's an increase in the vaccine effectiveness back to 81%. You can see there's a waning of the immune response, especially with the smaller children. They attribute this maybe because they're using a smaller dose, the 1/3 dose among this age group. So there's a more waning of the immune response, but however, with a booster dose, their vaccine effectiveness will gradually return. So this study suggests a rapid loss of the protection against infection, especially in this Omicron era. And this study highlighted the importance of layer protection, including, apart from the vaccination, we need to wear masks and in children to prevent infection, and also other personal hygiene measures. And especially a booster dose is very, very important. But one thing we need to be aware in the mRNA vaccine, which is the myocarditis. We published this editorial in July last year. We are aware of this condition, so we set up a working group to observe, to record down this condition after the launch of the mRNA vaccine in Hong Kong. And we recorded 33 adolescents after the vaccination from June to September. And we published this paper in the Clinical Infectious Disease. And we identified the risk of the myocarditis was higher among male, given the second dose of the BioNTech vaccine. So we reflect this data to the government, and then we changed the immunization program down to 1 dose since September. But in view of the surge of the Omicron variant, in December last year, we switched it back to 2 doses, but we separated the 2 doses by 12 weeks apart. Why? Because of this study in Ontario, Canada, showing that if we separated the 2 doses by a longer duration, for example, here, less than 30 days, the risk of the myocarditis was 94.5. If we separated by longer duration, you can decrease the risk of myocarditis by 1/10. So in Hong Kong, we separated 2 doses of the mRNA vaccine by longer duration. This can markedly reduce the risk of the myocarditis. So up till this moment, since the 25th of February, we shortened the duration of the 2 doses of mRNA vaccine from 12 weeks to 8 weeks. So this is the latest recommendations. And also, experts recommend we give the vaccine in the anterior aspect of the thigh. This is believed that the distance away from the heart can further reduce the risk of the myocarditis. This is a study performed by the University of Hong Kong by Professor Lau, and showing that in the adolescent from age 11 to 17 years old, given 3 doses of the CoronaVac and 2 doses of the BioNTech vaccine, and showing that the adolescent given 2 doses of the BioNTech vaccine and 3 doses of the Sinovac vaccine, they all able to mount an Omicron neutralizing antibody. So these 2 vaccines are very good. If you give 2 doses of BioNTech or 3 doses of the Sinovac vaccine, they all can mount a good Omicron neutralizing antibodies. So I make a comparison of the 2 vaccines, and this is used for educating our population in Hong Kong. And I educate our parents, for example, the differences in the platform used. For example, one is inactivated protein and one is the mRNA platform. And also they both can prevent the severe disease, and the duration of separation between the 2 doses, and the mode of administrations. And also we need to teach the public the T-cell response. Although some people mention the antibody may wane with time, but as an immunologist, we need to understand the T-cell response still persists. And this is the basis of a vaccination against the disease. And also we need to mention a concern of the myocarditis regarding the mRNA vaccine. So this is the latest schedule in vaccination schedule in Hong Kong, updated 13th of March. You can see we recommend the 3rd dose. 3rd dose for healthy people in Sinovac and also BioNTech vaccine. Regarding immunocompromised individual, we advise a 4th dose, and 90 days after the 3rd dose of the vaccine for immunocompromised individual. We also published a statement regarding the vaccine allergy. This gives confidence to parents that if your child has allergic history, not related to COVID vaccine or their component, and asthma, allergic rhinitis, eczema, even chronic spontaneous urticaria, you can still receive the COVID vaccination. This also gives confidence to parents that you can bring their child to vaccinations despite you have this allergic history. And parents can access this statement via this QR code. So thank you very much for inviting, and I really learned a lot from this conference. Thank you very much.